3 rules. If you're going to be a nonprofit hospital, you've got to give some charity care. Nobody really oversees your billing of the uninsured, but there is somebody there who's going to argue with you about how you bill the insured. So now we've got the perfect setup for a home run play. And the home run play is, don't charge the insurance company as much for the care that is provided to the insured patients. Charge the uninsured patients 5 times more than you charge the insured patients. Collect what you can from them, and then claim the rest of the amount that you didn't collect from the uninsured patients is charity care. Win, win, win. When a hospital overbills, someone they know is not likely to be able to pay, solely so that they can both squeeze them for as much payment as possible and maximize the claim for charity care that they have forgiven. That's predatory, plain and simple. The hospital is preying on that family, treating it like nothing more than one more opportunity to maximize revenues, maximize dollars flowing into the hospital. The family is nothing more than a piece of meat to that hospital, something to be feasted on, something to profit from, and a carcass to be left behind at the end. When a hospital owns an insurance company, then that means there is a lot of interest in maximizing collection from the people who have no insurance. The idea here is the 2 powerful players, that is the hospital and the insurance company, team up to make sure that their costs jointly are as low as possible and that the uninsured bear at least as much as they can possibly shift over to them for the cost of operations. When hospitals own insurance companies, in effect, there's always the possibility for really nice sweetheart deals. The hospital agrees to a big discount for the insurance company in terms of what it will pay for blood tests or throat swabs or access to the operating room or the emergency room. But woe be to the person who walks in who isn't covered by insurance. For that person, it's now time for full freight, so that we have this irony that the people, frankly, who have more money and some health insurance coverage, they or their insurers are actually billed less and pay less than do the uninsured, who by and large are uninsured because they can't afford health insurance. So this is using the healthcare system to assure that it may not help the rich get richer, but it sure helps the poor get poorer. Money, money, money. It's all about how to bring in more money, in this case, not to pay it out to shareholders, but to grow an empire, to make it bigger. It's better to be running a big, big, big hospital than just to be running a big hospital. It's possible, because of our tax-exempt structure, for these hospitals to maximize revenues, minimize charitable care, and then take that difference and reinvest in becoming an ever bigger and ever more powerful institution. You know, at some point then, what happens is the institution almost takes on a life of its own. It becomes entirely self-protective. The legislature protects the hospital. It hires advertising to make sure that the press is quiet and non-critical. The institution is no longer there to serve the people. It's there to serve itself. America's been following market-based solutions for more than 100 years. The first one is level the playing field. If someone wants to dominate a market, then make them pay taxes. That way, at least, the playing field's level, and anyone else who comes in who will have to pay taxes would be competing on even ground. The second is that we learned the lesson back in the late 1800s that monopolies are not good for markets and not good for Americans generally. And Teddy Roosevelt made his name as a trust buster. We have antitrust laws. The question is whether or not those antitrust laws are being vigorously enough enforced by our own elected officials to go out there and examine what's happening in marketplaces, including healthcare marketplaces, to make sure there isn't a bully boy that dominates a particular market. And if there is, the laws are in place. We don't need new laws here. We just need enforcement of the laws to break up that monopoly, to say no. In the same way that we said we weren't going to let railroads have monopolies, we weren't going to let particular trucking companies have monopolies, we're not going to have that sort of thing. This is America in many ways at its most vulnerable. America in a position where it's hardest to think about shopping for prices, where the consequences of anything less than the best possible care can mean the death of someone you love. It's at that moment that we most need to be careful that there is an active, aggressive healthcare market with plenty of healthcare providers who want over and over to keep raising the standard of care, raising the healthcare services available to the people who need them. Here, more than any place else in our economy, we need to make sure that our elected officials are enforcing the laws that exist to protect the rest of us. If not here, then where? Isn't that it?